Hi folks, it's Marvin Music here. A big thank you for allowing us the privilege to serve as your Medicare agent. As many of you know, every year we normally have open enrollment meetings, and these are held at a couple different locations around the city. Usually have 500-600 people at several locations, and this year because of COVID we're not allowed to have that size of a group in any of the colleges, and so want to make sure that you're still up to date. And so in lieu of the open enrollment workshops, I'm sending this video out to you so you're real clear as to what you need to do during this period of time. And so I want to remind you that you are going to, of course, be inundated with lots of mail, lots of email, certainly advertisements on television. And a lot of these companies say that there are some major changes to Medicare this year. And the truth is there's very minor changes to Medicare this year. But they say that so they can stir you up, getting you to call them, and then they're going to try to talk you into switching a plan. And so just want to make sure you know that there really are no changes. I'm going to go through some of those. But before I do, I just want to remind you that if you're watching this video, it means that you are presently covered by a Medicare Advantage plan. If you're covered by a supplemental plan, then we have another video for those of you that are covered that way. So just be sure this is for those that are on Medicare Advantage plans. So if you need to switch those plans or do anything during this particular period of time, I'm going to explain what you need to do and how you need to do that. All right, so let's get started. First off, I want to make sure that you're aware that when you see these two companies, they are one and the same. And most of you met us through Enlighten You Financial. That has been our workshops that we do live, public in Kansas City, also in St. Louis. And because of COVID, we actually started a separate division now within our company called MedicareSchool.com. And this is our online presence. So this is actually in 35 states now throughout the country. So those that are outside of Kansas City or St. Louis, then this is how they meet us, is through our online videos and through a lot of people who come to us that way. So we are one and the same. Just want to make sure those of you that are an Enlighten You family know that MedicareSchool.com is us. And it's been really a real privilege to be able to take our educational platform and spread it around the country. All right, so that's that. Now, let's talk about changes. Number one, Social Security is proposing a slight increase this year. This is called a COLA, or cost of living adjustment. Right now, that proposed number is 1.2%. It has not been voted upon and approved by Congress just yet, but that's what they're proposing. And so that means they're going to give you a slight increase into your Social Security. And so anytime they do raise your Social Security up, they always raise the Part B premium as well. So here's the proposed number this year. They're saying that they're going to bump to $148.50. So right now, if you're on Social Security, your Part B premium is taken right out of your check. So it's $144.60 a month for 2020. They're proposing in 2021 to go to $148.50. So it's going to go up, what, $3.90. And so we should probably see that happening in your January Social Security checks. Now, this is for those that, if you're single, you make $87,000 or less. If you're a couple, $174,000 or less. This is how much you pay. If you're single and above $87,000 or married and above $174,000, then you will pay more for your Part B premium. This is the base. If you're higher than that, then you have those IRMAs, or those surcharges that are added to Part B. So that's the numbers proposed for next year. And then Medicare Part B deductible. As you know, Medicare has 6 different gaps. One of those gaps is the B deductible. And this year it's $198. They're proposing that gap go to $212. So if you decide to go back to original Medicare and get a G plan, as many people do, that have supplemental plans, then this would be your out-of-pocket expense. The B deductible, $212, would be out of your pocket. And so the first $212 that comes through the B of Medicare, which is outpatient and doctor services, that's what you would pay. Okay, so that's that change, at least an estimated change. Now, open enrollment is October 15th through December 7th. So we have this 6-week period of time that if we need to switch, this is the time that we must do it. Now, we live by the philosophy, if it ain't broke, don't fix it. Terrible English, but a good philosophy when it comes to Medicare. And so if you like your plan and you're still happy with it, it's not like you have to change. But if we are going to change, this is the time during the 7 weeks that we need to make the change. So let's talk about the details of making that switch. First off, this is what your present coverage looks like if you're on an Advantage plan. The Advantage plan is called MA plan. That means it covers inpatient, outpatient, and then added to that is a prescription drug plan. That's why we call them MAPDs, Medicare Advantage Prescription Drug, all in one. And so you have one card that takes care of everything: inpatient, outpatient, prescription drug plan. So that's what it looks like. So what are your possible options this year during the annual enrollment period? Number one, you can switch Advantage plans. Every year, there are companies that offer new plans. There's companies that will enter the market. And all those companies that are either in the market presently or in the market, we actually are brokers for those plans. And so you may want to switch your Advantage plan. Now, frankly, there's only about a 10% chance that that's really necessary, because the plans really don't change much from year to year. Truly, there's only so many pennies in the dollar. So there's really only so much they can do. But they may tweak some things a little here and there to make them look a little bit better than their competitors. But the truth is they're very, very similar. But you can switch Advantage plans. Now, if you decide to do that, you want to have a reason for that. And that reason should come as you get your annual notice of change, called the ANOC, that it will be mailed to you sometime between the 1st of October and the 15th of October. Please open up that envelope. It's a rather thick one. It's called the annual notice of change, and find out what they're doing. Specifically, you want to find out what they're doing to their network and also to medications, because it's possible that from year to year, they can drop medication from their formulary. They can do what we call re-tiering a medication. So in 2020, you may be on a medication that's a tier 3, and next year it's a tier 5, or it's a tier 2, they bump to a tier 4. And I've seen tiering change the copay of a medication $150 to $175 every month. And so that's why you always open your annual notice of change to see what they're doing with the plan. Have they made any change that is really going to hurt you? In other words, something adverse that this change is bringing into your life. We don't want you to be hurt by that change, okay? Open the packet. It's going to take you 10, 15 minutes to go through it to figure out exactly what's changing and if you're going to be impacted by any of the changes. All right, now, if you decide that they have made a change that you're not happy with, or you just would like to try some other plan, we need you to go this year to enlightenuenroll.com. Now, notice the spelling here. We have misspelled enlighten, right? It's ENLIGHTNU, and then the word enroll.com. And here, you'll be able to put in a little bit of information, and all of the Advantage plans that are available for you will be on this particular website. So it's a wonderful tool, and it will take you maybe 15, 20 minutes to be able to work through this, to be able to really look at all those Advantage plans. And they'll be able to show all the differences, and they'll show how your medications are covered. Really, all the details will be there. And so if you don't already have an account, and most of you that are with us, we have set up accounts for you, but this system just started a couple years ago. So if you don't have an account and you want to create one, it's very simple to do. You'll just put your name and address and your date of birth in there, and a few little bits of information, and they'll store all that for you. And you'll need to create a username and password. Okay, so you need to create that, and then we want you to update. If you already have an account, update all your medications. So let's say this year you're taking 20 milligrams and that switched to 40. So update to 40 milligrams. Maybe the doctor had you on 2 this year and just moved it to 1 a day. So you'll change the frequency as well. If you've added a medication during the year or removed one, just update the meds. And again, save all that login information. Number 3, then what will happen is they will, after you're up to date, they will confirm your pharmacy, retail pharmacy. And then it'll go to all the plans, and what it's doing, it's shopping all the plans based upon your medications. And it's going to take those plans, going to put them in order of top to bottom based upon the medication coverages. And again, you need to look at the details, because some of those in there are going to be HMOs and some are going to be PPOs. And remember the difference. HMOs typically require you to have a referral from your specialist. HMOs typically are going to have, let me rephrase that. HMOs require you to see your primary care doctor before you see a specialist. You have to have the referral. PPOs do not require that. HMOs are going to have smaller networks, not as many doctors and hospitals to choose from on the HMOs, so PPOs are going to be a little bit bigger. Also, HMOs, you must stay in your network unless it's an emergency or urgent care. PPOs allow you to go out of the network if you want to do that for whatever reason. As long as that out-of-network provider takes Medicare, you can go there on a PPO plan. So again, you'll look those plans over and you can begin to compare those. Now, if you see something on this website that you're happy happy with, and you say, hey, that's the plan I want to be on. From our website, you can push add to cart and then enroll. And again, all your information is saved, so they'll ask you to confirm your Medicare claim number and just a couple of bits of information. You'll confirm that, and you can actually self-enroll right from our website. However, if you have any problems there, any doubts there, then you can also schedule a call with one of our advisors, and we'll answer any questions that you have, and then we are happy to do that enrollment for you. Now, keep in mind, when we send this email to you, there's going to be a link in there for you to actually schedule a call. And so the sooner the better. So if you decide you do want to switch Advantage plans and you would like us to be a part of that with you, pardon me, we're happy to do that, but just be sure to schedule a visit with one of our advisors, and we'll make sure you're making the right decision. You know all your options, and we're happy to assist in that process. Now, if you use our website or you call us, we will continue to be your agent. But if you go outside of our company, through some call center or some other agent, then we cannot help you further. Only the agent of record is able to assist you. We would, of course, count a privilege to continue to be your agent of record, but also when you have problems, you will be able to call us, because again, we're full service. We're not just going to write a plan and say see you later. We're available for you. And again, the price is all the same no matter who does the Advantage plan for you. So you're not going to save any money by going somewhere else. All the plans are going to be the same. So we'll continue to serve you if we do that switch for you. All right. Now, let's talk next about some dates that are very important to remember, and I'll remind you these at the end. But the plans that are available for 2021, you can find them at enlightenyouenroll.com, and those plans will be available after October 1st. Now, the company that manages Medicare.gov also manages our website, so very reliable source, and they're telling us it should be available October 1, and if it's not, it should be shortly thereafter. All right, now, you can enroll using enlightenyouenroll.com after the 15th of October. So they allow you to view the plans for the first 2 weeks of October and then enroll in the plans beginning October 15th all the way to December 7th. Now, the plan you're on right now, that Advantage plan, is going to be yours until December 31st. The new plans will not kick into effect until January 1. But if we have to switch, we have these particular dates that we have to make the switch. And again, we're going to send you here in just a few days, we're going to send you a very in-depth video so you'll know step by step what you need to do to be able to get your records up to date and to look at all the plans yourself. And then, of course, to self-enroll or call us if you want us to do that. But all that'll be coming to you real soon in an email. So we know that you can switch your Advantage plans. Secondly, you also can switch from your, or possibly I should say, switch from your Advantage plan to a supplemental plan. So if you decide that you want to get out of that copay system and the different features of a supplemental plan, and you would like to try a supplemental plan or go back to a supplemental plan, here's the rules. Number one, keep in mind you will now have a premium. Most of you that are on Advantage plans are paying zero premium or very low premium. If you go to a supplemental plan now, you're going to have a monthly premium because on the Advantage plan, you had no premium because you kind of paid as you go for services. When you take a supplemental plan, what you're doing is basically transferring the risk of all those out-of-pocket expenses to an insurance company, and anytime you transfer risk, you got to pay a premium to the insurance company to take the risk. Right now in our area, the premiums are going to be anywhere from about $125 to $150 a month. And again, this is just a range. This is going to be based upon your gender and your age and your tobacco status, okay, your zip code, location. So all that goes into what the initial premium is going to be. And so you're going to have a monthly premium now. Instead of paying copays, you pay the premium. And then also now our drug plan is not included within the supplemental plan. It's a separate, we call them standalone drug plans. So again, that's different. With your Advantage plan, you had inpatient, outpatient, and prescription drugs all in one card. Now we would have three cards. We're going to use our A and B. Medicare pays first, supplemental card to pay second. So that's for inpatient and outpatient. And now we have a separate card for our prescription drugs. All right, so we have three cards and we have three premiums. Now, the average drug plan right now in America is right at $30. That's average. There are several plans that are in the teens, and if you take very few meds or no meds, you'll be in a plan cheaper than $30 for sure. If you have lots of meds, you may have to be a little bit higher in that regard, but there's plenty of those plans to choose from, and we'll walk you through the whole process and show you how that's done. Okay, and so that's number one difference. You're going to have premiums. Number two, In order to switch you from your Advantage plan to a supplemental plan, we have to go through underwriting. And this means that the insurance company has to approve you to make the switch. Now, if you're generally healthy, no issues going on, heart, lung, liver, kidney, cancer, diabetes, things like that, you should have no problem switching. But if you have some major issue that's happened in the last 2 to 5 years, and by the way, they will take diabetes, you just can only take so much insulin, and you cannot have any of the consequences, any of the like retinopathy, neuropathy, any of those kinds of complications from diabetes. Insurance company's not going to take that. But the point is you have to go through underwriting. So if there's anything major, heart, lung, liver, kidney, cancer, diabetes, in the last 2 to 5 years, you may not be able to make the switch. But if you're generally healthy, then you may be able to do that. But again, the underwriter has to approve that. So we're going to ask 25 health questions. We're going to check your medications. We're also may need a statement from your doctor. And so those things are involved in underwriting before we can make the switch. Okay, and so that's why we do this. Number one, there are many people that will be switching. This happens every year. And the underwriting pipeline gets filled up very quickly. So if you feel like you do want to switch from Advantage to Supplement, let us know ASAP, because we want to get in line. And we want to get your application in. If you put this off really almost any time into mid-November after, you may not get through underwriting because they get backlogged in underwriting. So let's do it early. And in fact, you don't even have to wait till October 15th. We can do that now if you want to, because we're not going to be canceling anything until after we got approval. All right, so that's the process. So we got to go through that process to make that switch. Now, your Advantage plan is going to run all the way through December 31st. So when we start your supplemental plan, it's always going to start January 1, and the drug plan is going to start January 1. All right, and remember this, we are not going to cancel anything until that has been approved. So we just keep the same coverage, and if we get approved in underwriting, then we can make the switch and change drug plans and all those kinds of things that will follow that. All righty, now if you want to switch to a supplemental plan, here's what we want you to do. We want you to go to this website, switchtosupplemental.com. That's one of our web addresses, switchtosupplemental.com, and you fill out a form. Why? Because again, we have to find a drug plan for you, the medications that you're on, the underwriter wants to look at. We're going to ask you those 20 to 25 health questions, and then we're going to get a statement from your doctor. So that's why we have to have this information in order to make sure that we can provide the right information to the underwriter so we can see if we can get you approved. All right, so that's switching to a supplemental plan and the process that's involved with that. All right, now a couple things about drug plans. Now, if you have an Advantage plan, your drug plan is part of that, right? If you switch to a supplemental plan, it's a separate plan. But regardless, whether it's embedded or it's separate, we still have these details with drug plans. I want to give you the 2021 numbers. Number one, if you decide when you get a prescription filled, you can either get it filled through your plan, or sometimes GoodRx or some of those other discount websites can give you a better price. And if it's cheaper through a GoodRx coupon or one of those coupon programs, then use that. You do not have to run it through the plan. You can use it whenever it's smart to do so. Now, when we get prescription drugs filled, remember that every drug plan has 4 stages. So the same medication we're on could change copays 4 times in the year, okay, potentially. And so this is the same structure that has existed for years, ever since 2006. So we have these 4 stages that we have to go through. So I want to give you an update on that because these numbers change every year. So here's the stages. Stage number 1 is the deductible stage. Medicare sets the deductible. This year in 2020, it's $435. Next year, it's going up 10, so it's going to $445. And this just simply means through your copays, the first $445 is going to be paid out of your pocket. Some of you, your meds are very cheap, maybe $10 a month. You'll never reach the deductible. Others of you, if your meds are very expensive, you may reach the deductible fairly early, maybe a month or 2. But the plans are going to have a deductible. You've got to meet the deductible through your copays. And if we meet the deductible, that takes us to stage 2. And in this stage, these are just simply copays. But what's happening here is Medicare is tracking the retail cost of your medications. You're not paying retail, but they're tracking retail. You're paying a copay, and the insurance company is paying the balance. But together, your copay and what the insurance company pays is the retail price. And that retail total, if it ever reaches the threshold established by Medicare, then you're done in stage 2 and you go to stage 3. This year's threshold is $4,130. So total retail cost ever reaches $4,130 anytime in the year, We are now done in stage 2, and we're going to stage 3. And in stage 3, this is called the donut hole or the coverage gap. Now, what happens here is, again, we're going to have a different copay. It will be 25% of the retail cost. So if you have a medication in the donut hole that costs $100 retail, you'll pay $25. If it's $500 retail and the donut hole costs you $125. Now, they've told us that for those people who are on insulin, that insulin prices are supposed to come down into 2021. We don't have any details about that yet. That's just something that's been promised by the administration. We know that's forthcoming, but again, no details yet. But hopefully those of you that are on insulin will not necessarily hit the donut hole as early this year, maybe even never this year. That'd be wonderful. But we hit the donut hole because we've hit the retail threshold, and while we're here, now we're paying 25% of the retail cost, and now they're tracking a new number, $6,550. So all the money being spent out of your pocket plus manufacturer discount. Now, just so you know, only 5% of the Medicare population ever reaches stage 3. Only 5% go to the donut hole, but if you do, now you're going to have a higher copay. And if you ever reach the $6,550, which is everything you've spent and all the manufacturer discounts, then you would be done with stage 3, and you'd go to stage 4. And this is called catastrophic. So the only painful part of Medicare drug plans is still this stage 3. The good news is only 5% go there, and only 1% ever get to stage 4. Stage 4 medications are very, very cheap. But that drug plan, whether it's separate or embedded in the Advantage plan, still has these 4 stages. So we wanted you to be up to date on that those numbers this year. All right, that takes us then to just a reminder, and I'll close. Plans available again at EnlightenYouEnroll.com. They'll be there October 1st or shortly thereafter. And then if you want to switch any plan, then you go through the process we just discussed. All that is EnlightenYouEnroll.com, and you can begin to make switches after October the 15th. You just can't submit anything until then. We can't submit anything until then. We're happy to assist after October 1st, but again, no submissions until after October the 15th. We'll send you in-depth videos, step-by-step instructions that you need to follow if you need to make any switches. Keep in mind, if you want to retain that relationship with us, which we hope you do, we have to help you with the switch, or you got to use our site to be able to do that. And you can do the self-enrollment, and we can still assist as your agent if you have any customer service issues. All right, it'd be our privilege to retain that relationship with you. Again, we thank you so much for giving us this privilege. Hope this has been helpful, and then look for some forthcoming videos as we start the open enrollment period. Thank you.